The Elderly Mobility Scale is a clinical assessment tool that was created to assess geriatric patients and their mobility in order to see if they are at risk of getting into accidents, and if they require any assistance to do certain things, specifically activities of daily living. The scale is divided into 7 parts, each one covering a certain activity. Here are the 7 sections of the scale. The person using the scale will have to administer a few tests in order to observe the patient performing certain actions, and they will be scored based on the scale's criteria, which will be discussed in depth later on. The tests involved in the Elderly Mobility Scale will give the healthcare professional using it a good picture of an elderly patient's functional status and mobility. The healthcare professionals who can benefit from using the scale for the evaluation of elderly patients are geriatricians, physical therapists, and occupational therapists. To use our free Elderly Mobility Scale, follow these steps. Download our Elderly Mobility Scale by age chart from the CarePatron platform, which you can find in the link in the description. The Elderly Mobility Scale is easy to use because each part has set rating options for you to select from based on observations. You simply need to pick the best rating. For lying to sitting, have your patient lie down on an examination bed in a supine position and their legs straightened. For this test, you just need them to assume a sitting position. Next, sitting to lying. Opposite of the first one, they need to lie down again in a supine position with their legs straightened. Sitting to standing. Have your patient sit down on a chair. Make sure that the chair is high or low enough that the patient is able to sit with their back straightened and they can plant both their feet on the floor. Have them stand up on their own, or with the assistance from others if needed. Tell them to stand up as soon as you say begin. You're going to time them using a stopwatch. Standing. Have them stand up and maintain their balance for 10 to 20 seconds. They can stand with their feet together or with one foot in front of the other. Make sure to ask them to reach for something or someone nearby while maintaining balance. Have your patient walk around the area or room for 2 minutes. Observe how they walk. Timed 6-meter walk. Similar to 5, but this time the patient has to follow a few instructions. Before anything, make a starting line and a finish line. These lines must be 6 meters apart from each other. Tell them to walk in a straight line from the starting line to the finish line. Make sure to say begin to signal them to start. Functional reach. Have your patient stand before a wall. They should be standing alongside the wall with their arm close to the wall at 90 shoulder flexion and have them close their fist. You'll first measure the starting position of your client, specifically the starting position of the third metacarpal head on the yardstick. Once you measure that, instruct your patient to reach as far as they can without moving their feet. Make sure to be close to them just in case they show signs of falling. Record their reach. When recording the reach, keep in mind you're recording in centimeters. After getting all the scores, calculate the sum, then refer to these designations. Here is a sample of our Elderly Mobility Scale, which you can find on our CarePatron platform. To find our Elderly Mobility Scale, go to our CarePatron platform or click on the link in the description. In our template section, we have a variety of templates and worksheets for you to use with your patients. You can filter or type in the keywords to find the worksheet. Thank you for watching our video at CarePatron. If you enjoyed this video, give us a like. If you would like to see more videos like these, subscribe to our CarePatron channel or click on one of our recommended videos.